Today, we're going to talk about a condition in dogs that can be a real puzzle, even for vets. It's called Addison's disease. Now, it's known for being a master of disguise, but the good news is, once you know what you're looking for, it's actually very manageable.
So, has this ever happened to you? Your dog just seems off. They have these days where they're tired, maybe they don't want to eat, maybe they even throw up a little. But then, right when you're getting really worried and reaching for the phone to call your vet, they kind of bounce back. That up and down, not quite right feeling can be so frustrating and scary. Well, we're going to look at one possible cause for these mystery symptoms. All right, so let's start with the absolute basics. What exactly is Addison's disease?
Okay, so the official name is Hypoadrenocorticism. A bit of a mouthful, I know, but all it really means is that a dog's adrenal glands, these two tiny glands near the kidneys, they just stop making enough of two super important hormones. One is cortisol, which is the body's natural stress handler, and the other is aldosterone, which keeps the body's salt and water balance in check.
You know, a really good way to think about it is like this. The adrenal glands are your dog's internal battery charger. So a dog with Addison's is kind of running on a low battery all the time. They just don't have that hormonal juice to handle stress or to keep their electrolytes and hydration where they need to be, and that's why the symptoms can feel so all over the place.
So you might be wondering, are some dogs more likely to get this than others? Absolutely. And the answer really comes down to genetics.
And when we say there's a genetic link, we are not kidding. Any dog can get Addison's, for sure, but some breeds are just way more prone to it. Just look at the standard poodle. They have over 51 times the odds of developing Addison's compared to a mixed breed dog. That's huge. Labradoodles and Westies, you can see they're also at a much higher risk. So yeah, your dog's breed can be a really big clue for your vet.
And what about age? Well, it usually shows up in young to middle-aged dogs. The average age when they're first diagnosed is right around 5 years old. You know, right in the prime of their life.
Okay, so what signs should you actually be watching for at home? This is where it gets tough, because Addison's has this nickname. We call it the Great Imitator. And here's why. The most common signs are things like lethargy, not wanting to eat, and vomiting. I mean, that could be a dozen different things, right? That's why what you see at home is so incredibly important. You noticing that these signs come and go, that's probably the single most valuable piece of information you can give to your veterinarian. This quote from the literature just sums it all up perfectly. The signs are vague, they wax and wane, and they're rarely pathognomonic. Now, that's just a fancy vet word that means there's no single symptom that screams, hey, this is Addison's disease. The symptoms just appear, then they might fade, and then they come back, which makes it a real challenge to diagnose without the right tests.
So, you've gone to your vet, you've told them your concerns, and they're thinking it could be Addison's. What's next? Well, here's some really good news. The path to getting a diagnosis is actually very clear and very reliable.
It's basically a two-step process. First, some initial blood work will often show a classic pattern. The potassium level is high and the sodium level is low. If your vet sees that, it's a big red flag. From there, the final definitive answer comes from something called an ACTH stimulation test. We give a little injection that should tell the adrenal glands to produce cortisol. If they don't respond, if we get a flat line, then that confirms it. It's Addison's. Now, hearing a diagnosis like this can be really scary. I get it. But this is the part of the story where things take a really positive turn. Because Addison's disease is totally manageable. The treatment is lifelong, and it's all about replacing those hormones the body can't make anymore. We have two main ways to do this. One is a monthly injection called DOCP that takes care of the aldosterone, and then you give a small steroid pill every day for the cortisol. The other option is just one pill a day called fludrocortisone that actually replaces both hormones. Your vet will help you figure out which plan works best for you and your dog. Really, a happy life with Addison's comes down to just 3 things. 1, consistent, lifelong hormone replacement. 2, regular checkups and blood tests to make sure the dose is just right. And 3, working with your vet so you know when you might need to give a little extra steroid for stressful events, like going to the groomer or having family visit. And this is the most important takeaway, the absolute best news. Once a dog is diagnosed and on the right treatment, they can live a completely normal, long, and wonderful life. This is not a death sentence. It's just a manageable condition, and honestly, the prognosis is excellent.
Remember, this information is for educational purposes and is not a substitute for professional veterinarian advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, healthy, and happy life.